But the real good news, or the important news about the aging brain, is that it is modifiable. This is not a static picture. It's slower, but can get a little faster. It's inefficient, but it can get more efficient. The other cool thing is that there does not appear to be any limit on what people can learn. There seems to be no limit in total learning with the aging brain. Slower, longer, but no loss of the total amount. I think that's very important. The other thing that I want you to know, as soon as I swallow the last of these grape skins, the other thing that I want you to know is that this change in speed and efficiency that we talk about as an aging phenomenon is measurable at age 28. This is not something that comes with your first gray hair, or the need to wear glasses, or hitting 60, or any of the other things that we say around senior moments. This happens at 28. How did they find that out? Put 100 people in a room. This is the kind of thing psychologists are good for. I mean, good at, not good for. This is what psychologists do very well, is they study things, they look at them, and they come up with like real cool, simple experiments. Put 100 people in the room, aging from age 20 to age 80. And they give everybody in the room a list of 10 words. And they say, I want you to memorize these. Well, people set about the task of memorizing them, and in 1 minute, they pull the list away. The 20-year-olds remember 10. 28-year-olds, 30-year-olds remember 8 of 10. 35-year-olds remember 7 to 8 of 10, and so on. And you get up to people who are hitting around 80, and they remember 4. So then you give them a new list, and you say, take as long as you need, up to 5 minutes or whatever. Memorize this list. And now everybody scores the same, between 8 to 10 total recall of that list. That's important to know, because we tend to think that we can't, because we can't do it the way we used to. Well, I don't solve problems now, nearing 60, the way I solved problems when I was 20. I didn't solve problems at 20 the way I solved them at 10, or at 10 from when I was 5. This idea that it somehow should be burdensome, that we have to do things differently, is part of the ageism in our culture. The fact that it takes me longer to learn something doesn't mean I learn it any less well or have any less fun learning it. And yet many of my contemporaries, and I suspect some of you in this room, lament the fact that your brain doesn't work as well as it used to, and so you quit using it because you think it doesn't work. Well, it does work, but you got to use it differently. That's the message. Now, the MacArthur Foundation, I'm sure you're all familiar with the successful aging story, reinforced these again at the macro level, looking now not just at individual performance, but looking sort of socially and at the culture. And the MacArthur Foundation, in their study, which was published by Rowan Kahn's book, Successful Aging, demonstrated that the impact of genetics, they said less than 50%, I would say 30% is the latest data, and that the strongest predictor of successful aging was education level. Just as a simple kind of fact, an epidemiologic fact, you look at the demographics. They also said, however, that they identified 3 modifiable factors that were important for predicting how successfully somebody aged. And they were maintaining or attending to health, which, by the way, I want to say doesn't mean never getting sick, because we all get sick from time to time. Being healthy means being able to manage disease that comes along and not have it overwhelm function. They observed that people who have an optimistic temperament age more successfully. And the good news about optimism is that it's something you can learn. It is something that some people are born with. How many people in the room have children? How many of you have more than one child? How many of you had the experience of bringing home one baby, having it sleep through the night, from the get-go, always smiled on cue when people came to say, cute baby, and another baby Same mom and dad, same environment, same family, cranky, curmudgeon-y, never smiles when the neighbors come, only spits up and doesn't sleep through the night for the first 6 months. Okay? Go figure. Temperament is real. We don't quite understand it, but it's real. And some people are born with a natural predilection, and you know what's coming, with a natural predilection towards saying that's half full. Okay? And other people are born with a natural predilection for saying it's half empty. Okay? Now, there are some people born with a predilection for saying, oh, there's still a good bit left. And other people born with a predilection for saying, it's almost empty. This is the way I get my breakfast and talk too. Now, those of you with a predilection for optimism, what do you say? Fill it up, exactly. Okay? This is not an empty cup, glass. This is a glass ready to be filled. Okay? Fill her up. Now, some people are born that way. Here's the great news. If you're not, you can fake it till you make it. Seriously, the brain doesn't know the difference. If you say, this is not an empty glass, and say, this is a glass ready to be filled up, even if part of your brain is saying, no, it's not, that's the dumbest thing I've ever heard. If you just say it, it actually changes the chemistry in your brain. No kidding. This is where all those self-help stuff comes from, like positive daily affirmations. This has a real basis in the brain, in neurochemistry, a real basis. If you get up and look in the mirror in the morning and say, this is going to be a really bad day, you have just increased the odds that it will be, because you have primed your brain with negative chemicals. If you look in the mirror and say, this is going to be a really great day, even if another part of you is saying, liar, liar, pants on fire, okay? If you just keep smiling, faking it, the brain can't tell the difference. That's extraordinary. I wish we had more integrity, we don't. But we can use that to our advantage. We can use that to our advantage to help prevent clinical conditions like depression. We can use it to our clinical advantage to help promote healthy aging, because optimism supports something called self-efficacy, which is the feeling that you can impact your world. It's what I've come to call autonomy in action. It's freedom of choice and being responsible in the world, getting what you need. And even people with pretty advanced dementia can have it, can experience it. When they nod in the direction of a red sweater over a blue sweater, they experience self-efficacy. This is something, once you get it conceptually, that you can just use it to blossom in your life. And then finally, Rowan Kahn said, it turns out that people who live in connection with one another, who have more social support, do better, have better successful aging, which means reporting good health, really, in part, than those who don't have social supports. The ACTIVE study, which was just published in 2002, reinforced this further, this notion of being able to modify the brain. And this isn't in your handout because I forgot it. So if you want to write it down, it's the ACTIVE study. The ACTIVE study was a, 6-week, 10-hour program for seniors, well over 2,000 participants, in which they basically did some training in 3 basic cognitive areas: reasoning, processing speed, and memory. And they were interested to see, can you in fact get better on those tasks that we know slow down? And no surprises, to me, no surprises, people were able to improve statistically significantly in all 3 categories.